Hello, everybody. For those of you who don't know me, I'm Dr. Stephen Goldstein. I'm a chiropractor. Been practicing in Limbrook, New York for the past 32 years. Today's topic is how to raise a healthy child. Do we have a health plan? I know we all have, or most of us have, health insurance. Well, health insurance is not a plan of health. Health insurance is really a plan for sickness, because that's usually the times we go into our health insurance is when we're sick, when we go to the doctor, when we go to the hospital, and thank God we have this health insurance. But what is the health plan? If you don't have a health plan, or not having a plan at all, is a plan to fail. So how do we get our children healthy? Well, the first thing I have to ask is, are your children taking any drugs? Are they taking any prescription drugs, over-the-counter drugs? If they're taking a drug, even if it's one drug, they're not healthy. Now, don't get me wrong. Sometimes drugs might actually be necessary. Sometimes drugs might be a good thing. 2013, I had bacterial meningitis, and I had an IV, and you better believe I needed those drugs. At the same time, I also was getting some chiropractic, some Reiki, prayer, power of prayer, positive thinking. So not to belittle what the doctors and nurses did, all those things together helped me to recover. Over the years, we've treated hundreds, probably thousands of children. Usually the way we get to see some of these children is parents come in, they'll tell me my child is sick again, and that starts the conversation. So how are they sick? What's going on? Well, they have recurrent ear infections, recurrent sore throats, stomach problems, allergies. They're taking inhalers. And of course, as a chiropractor, guess what I'm going to recommend? That they come in and get treated. So how does all this work? How does chiropractic help children to regain their health? Well, one of the things that can go wrong is when you have what we call subluxations, which is a bone that's puts pressure on a nerve in the nerve system. The body can't possibly be functioning normally. It's the nerve system that controls every part of your body. It controls your immune response. So if the nerve system isn't functioning the way it should at 100%, it's very easy for us to be susceptible to getting ill. And if we do get sick, the body has a tough time in fighting off that illness. The average child today, I know when I was growing up, usually we're taking 2 to 3 prescription drugs a year, if not more. And those prescription drugs, although, like I said, may be necessary, they also play havoc on your body. Antibiotics are there to kill bacteria. Bacteria are living cells. Antibiotics are not used on viruses because viruses are not living tissue, which is why many times when we have a cold, antibiotics are not prescribed or should not be prescribed. But what an antibiotic does is, yes, it kills off the bad bacteria, but it also kills off our good bacteria. It kills off our gut microbiome. These are the good bacteria that live in our gut. And by killing off that microbiome, it can cause a heck of a lot of problems, such as stomach issues. One of the things our good bacteria do is, believe it or not, it supplies us with nutrients. It makes a lot of our B vitamins. B vitamins are necessary for proper nerve function, necessary for a proper immune response. So taking these antibiotics, although might help, can also cause some damage. I'm going to read to you a study that was done in the Mayo Clinic. Symptoms of ear infections usually improve within the first couple of days, and most infections clear up on their own within 1 or 2 weeks without any treatment. The American Academy of Pediatrics and the American Academy of Family Physicians, they recommend a wait-and-see option. It was very interesting because years ago, as soon as a child had an ear infection, they were prescribed an antibiotic. The problem that they started noticing is this can lead to bacterial resistance, where those antibiotics were no longer working, were no longer effective. So they had to find other antibiotics. Well, over the years, I've treated a lot of ear infections, treated a lot of sore throats, and by taking that subluxation, that interference off the nerve system, the body was able to mount a proper response. And usually what we found is within 24 to 48 hours, these children were at least 75% improved. Some of them were as improved as much as 100%. There was another study I want to share with you from the British Medical Journal. They wrote, the appropriateness of outpatient antibiotic prescribing among privately insured patients. And what this study found was 35.5% were potentially appropriate. Notice they said potentially appropriate. Well, by going by that number, 64.5% were inappropriate, were not necessary. So how do we get these kids healthy? One is we have to look at their diet. We have to get them off sugar, or at least try and minimize their sugar. I know growing up as a kid, started the day with probably Frosted Flakes, Cocoa Puffs, that good chocolatey, sugary cereal. And usually I'd have at least 1 or 2 bowls of sugar before I went to school. Well, what does sugar do to the brain? It basically turns it off. So basically I was going to school and all I had was an empty skull. I feel sorry for these teachers who are teaching these children, and most of them have been sugared up, and they're really not functioning at 100% because of it. So sugar can cause a problem. As I mentioned, subluxations can cause a problem. So it's very important to check their nutrition, make sure they're getting proper nutrition, and to make sure that their spine is functioning without subluxations. Over the years, we have treated so many children with asthma, digestive problems, headaches, allergies, just to name a few things. I happen to be one of those children. I was, as I said, taking antibiotics for recurrent ear infections, recurrent sore throats. By the age of 12, that killed my microbiome, so I started having stomach issues, had headaches. As I said in other Facebook Live, my father was a pharmacist, my grandfather was a pharmacist, so medicine was pretty much candy to us. So I had headaches every day. I was on nose drops, antihistamines, you name it, I was on everything. And at around 12, I threw my back out and was on more meds from the orthopedist. And finally, threw my back out again. I was 16, went to a chiropractor, and as he got my body to function better, as the health plan was to get me healthier, all those drugs were thrown away. Just to give you an idea of some of the patients, some interesting cases we had a patient with Down syndrome. And his mother came in and then was telling me about her son, who was one of the symptoms of having a Down syndrome child is they suffer from constipation. He was about 4 years old, couldn't lie on his stomach because his stomach was always distended. He had some roughness and rash on his cheeks, and mom brought him in, and we started adjusting him chiropractically. And within a short amount of time, he was able to lie on his stomach, his skin was clearing up, and all we did was get his body to function more normally so it can handle these problems. I had another patient who the mother canceled her appointment because her daughter always came down with bronchitis. It started as a cold, developed into bronchitis, and this happened 3 or 4 times a year. Of course, she was put on antibiotics, and I talked to the mother about chiropractic. She brought her daughter in, and for a year, she still had a cold once in a while, but it never turned into bronchitis. The last thing I want to talk about, actually a few last things I want to talk about, is growing pains. I can't tell you how many times I've heard my child suffers from growing pains. Their joints hurt, this hurts, that hurts. Well, growth is not a pain. So eventually they bring their children in, we adjust them, they get off the table, and whatever aches and pains they were suffering from is immediately gone. And I turned to the parents and I said, I guess they just stopped growing. Growing pains is normal, it's natural. Growth is normal, it's natural, and it shouldn't be a pain. The other thing we tend to notice is when we have these subluxations, especially in the little bodies of children, it causes irritation. And so we can see children that are hyperactive, we can see children that are irritable, that have tantrums, and as we start getting their body functioning more normally, the parents always tend to report to me, they're not having tantrums anymore. They're not as stressed out anymore. They're a lot calmer. So these are the things that we notice in our practice when we're treating children. Lastly, colic. Nobody likes to deal with colic. It keeps the whole family up for hours and days on end, sometimes for months. And we've had a huge success rate in treating colicky babies. Many times we get the children that have gone through the medical realm, that have gone to the pediatrician, that have gone on the drugs with no success. So we tend to get some of the worst cases. I remember one case, my mailman came in and he looked like he needed a good night's sleep. And he said his daughter's suffering from colic, they haven't been sleeping. So I told him, bring your daughter in. And eventually the mother did bring her daughter in. We treated her for the first time. When she came back for the second treatment, the mother said to me, I know you switched babies on me. This is not my daughter. For the first time, she slept 4 hours through the night. After the next adjustment, she was sleeping 6 hours through the night. And all this by getting the body to function more normally, to function the way that it was intended to function. So get a plan on raising your children healthier. Think about getting them off sugar, especially that first thing in the morning. Find something else, get them some good protein, find something else to get them on. Look into some good nutrition. And in my office, we do nutritional response testing, so we do have some great nutrition that we put our patients on. And find a chiropractor. You have nothing to lose. The worst side effect you can have with chiropractic is getting your body to function normally again. So thanks for listening. I look forward to seeing you next time. Oh, and by the way, the next Facebook Live, we're going to do Healthy Halloween. How can you have healthy treats for your children that are not these sugary candies and all that other wonderful tasting stuff, but plays havoc on your body? So I look forward to seeing you again soon. Have a great day.